Leanne, that's not...
Okay. So, Miss Martin, as a nurse, as a bedside nurse, what is the difference between an 8-hour shift and a 12-hour shift?
So, as a nurse, I worked both shifts. I worked a 12-hour shift and an 8-hour shift within my 3-year time span as a bedside nurse. I kind of preferred working the 8-hour shift over the 12-hour shift. So when you work 12-hour shifts, it's a pretty long day. You're getting into the hospital usually about 7 a.m., maybe a little bit earlier to get report. And then you're there until 7 p.m., which is a really long day. When you work 8-hour shifts, it's spread out a little bit differently. So you work more days, but it's less time. I feel like you're a little bit more sharp in your knowledge and in your skills as opposed to working 12-hour shifts because it's a very tiring and long day. If you work a lot of 12-hour shifts in a row, then you get really tired because you're just going back to back to back with very little sleep. The 8-hour shifts let you have kind of that normal day time experience where you go to work, you get off, you can go home, have dinner, do what you need to do with your family, and then go back to work the next day. So I personally liked the 8-hour shifts over the 12-hour shifts.
So basically for you the benefits is like you can spend time with your baby, put her to bed, help her do homework, because you have a 3-year-old, right?
Yes. Yeah.
Okay.
It makes you feel like you have more of a normal schedule, that you're not missing an entire day with your family because you're leaving before they wake up and getting home after they go to sleep. You're kind of there in the morning and then you get to be there at night as well.
So do you think that working at 8-hour shift is better because it decreases the patient risks and safety?
I think so. I think working an 8-hour shift, you're a little bit more sharp in your skills. You're not as tired usually. You're not getting as burnt out either. By the time you get to a 12-hour shift, you're pretty ready to just be home as opposed to patient care and thinking about things and medications. I think the risk is a lot lower when you're working 8-hour shifts because you're working just a normal time period as opposed to a 12-hour shift.
So as a nurse, what is the part that you enjoy the most working the 8-hour shift versus the 12 hours?
I think there's a couple things. I think working an 8-hour shift, you get that time with your family, which is really important. But I think you can also really spend a good amount of time with your patient and feel like you can give them a good amount of care and give them all that you have rather than feeling like you have to be there for 12 hours and that you're going to be really tired at the end of it. You can really kind of exhaust yourself out for 8 hours and then recharge at home and come back the next day and do it over again.
Well, Miss Martin, sorry, thank you so much for your time and helping me with this assignment at school. I'm looking forward to one day be one of your nurses at work, and it's been a great time with you today.
Thank you.